Good morning, everyone. Welcome to today's program on breastfeeding for young mothers. I am Dr. Chetan, Associate Professor of Psychiatry at NIMHANS, and I am also a member of Y20 Consultation Committee from NIMHANS. Today, joining us is Dr. Akshata, who is a neonatologist working in Hawaii, USA. She is also a breast milk activist, I should say. She runs an active Instagram channel and also has written multiple blogs on benefits of breastfeeding. I think today we have the best person to talk about breast milk and breastfeeding for youth. We welcome you, Dr. Akshata. Dr. Akshata, can you please introduce yourself?
Namaste. Thank you, Chetan, and aloha from Hawaii, everybody. I am Dr. Akshata. I am a board-certified pediatrician and a board-certified neonatologist, also a clinician scientist practicing in Hawaii, in United States of America, originally from Namabhadravati, Karnataka, India. So I am here today to talk about breastfeeding, and thank you so much. It's an honor to always share knowledge and educate people. Thank you for this platform.
Thank you, Dr. Akshata. Dr. Akshata, what are the benefits of breastfeeding for young mothers? See, we already know that there's a lot of benefits for the infants. There is so much written and so much talked about how much breast milk is beneficial to the infants. But how is it helpful for the young mothers?
Yeah, of course. Dr. Chetan, if I told you there's like a medicine that's been made and that helps you decrease your risk for diabetes, hypertension, heart attack, obesity, and rheumatoid arthritis, depression, anxiety, and slightly a little bit more on the list, mostly breast cancer and ovarian cancer, would you not take it? This is what breast milk is for young mothers and all mothers out there. Breastfeeding is that one magic miracle medicine, which in the scientific field, we're still learning and evolving. And every time we learn about it, it surprises us. The benefits of it are many. And it could take a whole day to talk about the benefits. And like I said, it's one magic medicine that will help decrease your mortality from so many different diseases and help you towards lead a good life and a healthy life.
Is there any scientific background and scientific work done on these areas as to how breast milk is beneficial in physical and mental health of young mothers?
So I was talking about several scientific literature out there in the community, in the scientific community, talking about the decreased risks of this. So these are several numbers. You can find it in the WHO website or the American Academy of Pediatric website, and several breastfeeding journal websites. Another resource would be lactation education resources. So these resources you can look at, and you will find the numbers wise. There's about decrease in about 20,000 cases of moms having less diabetes a year, or like over 100, over 8 lakh decrease in infant deaths a year just by choosing to proactively breastfeed. In addition, things like rheumatoid arthritis, type 1 diabetes, type 2 diabetes, and then heart attack risk, these are all decreased. And most importantly, breast cancer. The research on breast cancer has been there for many years. So we know that breastfeeding mothers have a several-fold decreased risk of breast and ovarian cancer. The breast milk itself has something called Hamlet cells, which can decrease or like in the microbiology world we have looked into recently in 2019, we didn't know until now, but it decreases the risk of 19 different types of cancers, and then out of which predominantly is a blood cancer or leukemia. This is more for the infants. This is what we know about the infants. Eventually, I think it will be translated to mothers too. It won't be a surprise if we find out that it will decrease more risks of cancers and diseases. Literature also supports the decreased amount of postpartum depression and anxiety in mothers who proactively choose to breastfeed, and in a situation where they are well supported and they can achieve the breastfeeding goal.
How does breastfeeding help in mental well-being of a mother?
So I think the science is very fascinating. I call it the science of nurture, and this is my pet peeve for the research. So whenever moms breastfeed, there's a lot of skin to skin contact, and there is this happy hormone called oxytocin, which is released. And every time you choose to breastfeed, you feed an infant about 10 times a day, and sometimes even more when they're cluster feeding. So every time you do that, there is this hormone, the happy hormone called the oxytocin, that's released, which does decrease the amount of mother stress. Every time you hold your baby close, the stress levels in the mothers come down. There is several studies also stating something called endorphins, like the morphine that's like a painkiller produced inside your body. Those are also produced, which helps relieve pain every time you choose to breastfeed.
Yeah. Oxytocin also helps in social cognition, according to the research in the psychiatric community. So it helps not only the infants, but also young mothers to bond well with the infant and also with other people in the surrounding. We know about the benefits of breastfeeding until now. What are the ill effects, if there are any, of breastfeeding for the young mothers?
Just the breast milk itself, there's only one condition where in babies with galactosemia, it's a very rare genetic disorder where babies don't have the enzymes in their body to break down milk and its components. And those are the situation where breastfeeding or mom's milk is contraindicated. However, there is no major contraindication to breastfeeding. If the mom is on cancer medication, that is another contraindication. Even the HIV positive mothers are allowed to breastfeed their infant, and the risk of transmission is less than 1%. So I think that that itself speaks volumes about the miracle properties of breast milk, which is evolving every minute. Mom make breast milk every minute. They make a customized breast milk for their baby. So breast milk has these natural killer cells and thousands of immune cells that can kill something as potent as HIV or COVID-19. There's truly no true contraindication apart from galactosemia and then the anti-cancer drugs. If mom is on chemo, most of them could be relative contraindication, but most of the time there is no true contraindication or harm from the breast milk itself. The benefits way outweigh the risk.
Yeah. That's very interesting to know that infants can be breastfed even when mothers have HIV. That's very interesting to know. Uh, in psychiatry, what we also do is that we ask the young mothers to breastfeed just before taking the medicines. Not many children would be able to latch on to the breast while breastfeeding. So what can be done during these times?
Yes, there are several children, they cannot latch. So in my world, I see premature babies. About 12% babies are premature. They almost are not privileged enough to be able to be born with a latch. Feeding is a skill. And whenever babies don't latch, they can cry. And it can be very hard for mom. The first thing I would say is keep calm. Try to keep as calm as possible, because it's very natural for a mother to also cry with the child when the child is crying, right? So I would say first try to keep calm and focus on things you can control. And babies not being able to latch it doesn't have to be a permanent issue. It could be a temporary issue, which if you stay focused and seek help, it can be solved. And there are specialists who go to extra schooling and extra training just to focus on the baby's ability to feed and breastfeeding. So one is a lactation consultant who takes extra training in figuring out the techniques of latch and how to encourage, support, and help mother through the breastfeeding journey. There is something called speech therapist who looks at the suck, swallow, and the coordination itself and can help the babies. And I think what you could do is reach out to your doctor, and the doctors can refer you to these specialists. So stay calm, be patient, practice, and feeding is a skill in a little baby world. In order for a baby to take a feed, mostly term babies, most of them do well, but sometimes even the term babies can have problems. One feed takes about billions of nerves to come together, like brain and the nervous system have to come together to put the act of suck, swallow, and breathe all at the same time. If you put it in layman terms, if somebody has never gone to gym and you ask them to run 5K on a treadmill, they cannot just do it right away. It is hard hard for them. So it takes practice, and then the babies learn the skill. So similarly, one feed doesn't not going well, or one latch, or a couple days of latch not going well, doesn't equate baby cannot do that forever. So it does take patience and perseverance to figure out what is happening with the baby, and be calm enough to seek help and practice, reach out and seek help. It does take an entire village to make the breastfeeding work. As natural as it seems, it can be very challenging, and it is important not to give up and be patient with yourself and baby and keep working at it. So there are complementary ways of feeding baby. Bottle feeding can be used as a therapy when babies are not able to latch. Mothers can use nipple shields. Sometimes the nipple anatomy of the nipple could be not feasible enough for the baby to latch well. So there are several things you could use: spoon feeding, katori, cup feeding. So there are several ways to feed babies until baby figures out how to latch. And the important part is giving your milk to your baby. If they don't latch, there's other ways to give it to your baby. You can learn about pumping, where you can show up to the pump, extract milk, store it, and give it to your baby. So there are several ways until your baby figures out how to latch. And sometimes if it's too hard to wait forever, it's totally okay to pump and give your milk to your baby. So pumping is also breastfeeding, because you are putting in that effort to show up to a machine 8 times a day to feed your baby. So that is also good. So as long as you're putting a good effort, that's totally worth it.
Dr. Akshita, you're a neonatologist, and in your area of expertise, you see a lot of premature babies, and it's very difficult for them to latch for many months after they are born. So how do you help young mothers in such situations to help them in breastfeeding?
Yes, so breast milk is medicine in the NICU world. It does decrease our neonatal or premature mortality over 80% in developing nations, and like over 50% overall globally. I think that's something that we are always we have a lot of resources to support mother, I would say. First we start off with counseling. We prepare mother to what is out there. So delivering baby premature can be viewed as a trauma in a unique way, where mom is separated from the infant right at birth, and then you're seeing your baby in so many wires and tubes and not being able to hold your baby right away and breastfeed. So mom has to first process that, and while she's processing, we are asking this mother to start hand expression and start giving milk to the baby. So a couple of things we do when we counsel about the benefits of breastfeeding, like how breastfeeding can improve the development of lung, brain. One of the fascinating things I also tell moms is that there's some pilot studies going on where they're injecting breast milk through the nose to the baby's brain, and we are seeing a resolution of the brain bleeds. So we got to see how we know that it's safe, we know that it's working, we need to extend the study to larger population. So I think the idea behind it is your breast milk has stem cells, which has the power to regenerate a brain cells, which if the brain has a bleed. So that's how powerful this is. And as hard as it is for mom, we prepare her to try to show up to that pump. And again, it's not just a mother's journey. So we also try to encourage and involve the father of the baby, grandparents, to help this mom and support this mom in every way, along with the lactation specialist, the bedside nurse. Everybody helps this mom and encourage her to keep showing up to the pump and extracting milk and giving her milk to the baby. So it does take a lot of persistence, a lot of preparedness, a lot of prenatal counseling, and postnatally it takes a lot of encouragement and just knowing more about when mom gives premature birth. The milk doesn't come in for 3 to 5 days, even though she shows up to the pump sleep deprived, and the mother is just born and she's also in so much pain, and it's one of the extremely hardest thing to do as a woman, as a mother. So just by acknowledging how hard it is and just putting in efforts is the key. And as a society, as physicians, as caregivers, we can all encourage that mother and just keep being the best cheerleader that we can to help this mother do the best she can. And her best could look different. Some mother's breast could look like I only could make 20 cc's milk. Some mother could make 200 cc's, and that's totally okay. Any amount of mom's milk is medicine for baby. So we just have to prepare and create an encouraging and supportive environment for this mother.
How can we involve young fathers in this journey?
Yeah, very good question. I think especially when they're born premature, I would say fathers can first read up on the breast pumps and what kind of breast milk pumps are all in the market. Help mother wake up in the night. The nighttime is the time where moms make the most milk, and that's when moms should wake up, especially between midnight to like 8 a.m. So you would need somebody like a coach to kind of wake you up and set the alarms. Every time mom pumps or breastfeeds, she burns up to 500 calories, so which is huge. And she could feel like really tired, shaky, hypoglycemic, at the end of the pumping session. So the father of the baby could be ready with the, water bottle, preparing protein snacks, cleaning up the parts of breast milk. When you're a pumping parent, so you have to clean the bottles and keep ready and fill the bottle and work on storing it, freezing the milk or storing it in the refrigerator. So there's a lot of work it takes. So it takes at least 30 minutes for one session. And imagine doing this 30-minute session 8 times a day. So it's like almost like a 8-hour work for like full-time job, I would say, full-time employee. So as a mother to pump and breast milk, give breast milk. So father of the baby can be the best cheerleader for his partner and work on all these things like taking care of the mother. So I tell the dads to take care of the mom so that she could show up to give the nurture, the best form of nurture to their baby.
Thank you for the answer. Now, if we ask you to give about 5 recommendations for young parents out there on breastfeeding, what would be your recommendation?
Okay, so one would be prioritize. So when you are pregnant together, both parents read up on breastfeeding, breast milk, benefits of it, preparing it, and most importantly, the challenges. So there are 3 phases to it. One is how to produce the production phase, the first week or so, and then the maintenance phase, and then handling all the challenges that could come with it. So I think preparedness is the key. So read up. There are several educational resources, the WHO, World Health Organization website, lactation education resources, American Academy of Pediatrics. Read up on that. I think that would be very important to know. Knowledge is the key. Second, prioritize. If there's one thing you can give your baby that will make a huge long-term impact on babies, like we are talking about decreased babies' risk of hypertension or lung diseases later on in life when they're older. So this is something that you can invest in, like how you save money to build a home. Save your energy, your knowledge, your time, invest in this journey so that you can face these challenges together and prepare for the journey. So I think one of thing is preparedness, then active investment, proactive investment, and then also acknowledging that it's as natural as it is, it's not easy. So figure out who is your tribe, who are the people, professional help you would be seeking, who is the local lactation resources out there in your society, in your system. These are the things you need to have a support system. Okay, if it's not working, who do I ask for? The primary doctor itself may not be able to give all the information. So I think it is important. We need to find out who is the lactation consultant near your area or the speech consultant in your area, in addition to the pediatrician. So just having that resource person would be really helpful. So I think, and then also have a mantra, because sometimes if one feed doesn't go well, or if like whole week of feed doesn't go well, things happen and it's hard. So how do you get back? How do you motivate yourself to show out to that? So I think that is something that is very hard because many of them don't know. And sometimes when we supplement with formula, it becomes a little more easier to give the formula. And formula is not poison. It is totally okay to bridge baby to help with formula, but your milk is superior and medicine. And if there's any opportunity to try and relactate, just focus on doing what is necessary. And the other mantra I tell is focus on the efforts and not the results. And also know that you're making a difference to the entire world by being that one proactive parent-child unit to give breastfeeding. So when you choose to proactively work on breastfeeding your child, you are decreasing the infant mortality in the whole world by close to 1 million. So that's a huge thing. So it's important that one person does it, and then you create a society which is more like support, like encouraging. Because when you breastfeed, some other mother is encouraged and inspired to do it. So I think it creates a chain of cycle where we create a world where we can give the most nutritious thing for baby. So I think these are a couple of elements, I would say.
Thank you. If I can summarize this, the 3 P's: prepare, prioritize, and proactive investment in
Absolutely.
So if we can do this, then I think a lot of young parents, young mothers and young fathers can be benefited by breastfeeding. Thank you, Dr. Akshata. Thank you for your time. You have been with us educating young parents on the breastfeeding, effects of breastfeeding. Thank you very much.
The pleasure is all mine. Thank you for considering me for this platform. Thank you, everybody. Bye.
Bye. Take care.